welcome back to Leading Veterinary Teams on Air. Today's conversation is going to be a little bit different, and it's a conversation that matters a lot. Geoffrey, I'm so glad to have you here. If you guys don't know, Geoffrey, he's a veterinary technician out of Colorado, and many of you might know him from social media for his humor, honesty, and real takes on life in the veterinary ER. His videos educate pet owners, validate veterinary professionals, and often make us laugh at the things that are otherwise really hard to carry. But his story goes much deeper than social media. He's lived through the realities of mental health struggles in this profession, and he's chosen to speak about it openly, not for attention, not for shock value, but because silence is one of those things that hurts us the most in vet med. Before we begin, I want to name that this episode includes discussion of mental health challenges that may be activating for some listeners. Please take care of yourself while listening. Pause if you need to, and know that resources are shared in the show notes. I'm really grateful you're here, and I want to give you space to share the story that you want to share in a way that feels right for you. Before we get started, can you tell anyone who might not actually know who you are a little bit about your background, how you got into vet med, and maybe why you decided to start sharing on social media?
Yeah, absolutely. First and foremost, it's an honor to be on the show. It's incredible that we have these platforms like the one you have where we get to share some real gritty truths about mental
Yeah.
health, about veterinary medicine, and as you said, silence. To me, silence is deadly. I have lost people, and I think everybody has at least one, if not multiples, that we have lost to mental health issues, be it suicide, addiction, whatever it may be. So I think that using a platform like this to spread that level of awareness is absolutely commendable and a beautiful thing that you're doing. So thank you for having me on the show. Thank you for doing this. Absolutely incredible. Yeah, as you said, so my name is Geoffrey. It's always like a debate on how to pronounce my name because it's spelled Jeffrey, but because I was born and raised in Holland, long story short, it's pronounced Geoffrey. And yeah, there's typically only one in the world because it's kind of a made up name at this point, and everybody likes to call me Joffrey, like Game of Thrones. He ruined my name. But yes, my name is Geoffrey. I've been in the veterinary field for 22 years now. I started on the lower side as a kennel technician, veterinary assistant, receptionist. Like I've done every job that you can name. And then I decided to get credentialed through Bellray in Colorado, which is a school where I got my associate's degree in veterinary technology in 2008. I will plug this all day long. Guys, get your letters behind your name. Get your credentials. It is there. It is. It's so important, and it's not important in the sense that like I've worked with assistants that run circles around technicians, and for the same
Yeah.
token,
Same.
I've worked with technicians who simply need a little bit more help and a little bit more education, a little bit more experience. So it's not necessarily about that name; it's more so that our worth and our the importance of us getting credentialed and leading that way into where we need to be as a respected occupation, I think is super important. So please get credentialed. But yeah, I got
Yeah.
credentialed in 2008 in the state of Colorado. I started in shelter medicine. I did GP for a while. I did specialty orthopedics was my jam for a little bit. And then I've revigorated my love for veterinary medicine in the emergency department. I'm an adrenaline junkie through and through. And so the minute that I thought like I should go into ER, which was terrifying. But I don't like to let fear dictate my decisions in life unless it comes to heights. I will not bungee jump. I will not parachute, nothing like that. Okay. But other than that, I was terrified of going into ER. And the minute that I didn't, I made that transition, which is a tricky one. I often, for all my skiers and snowboarders, call emergency medicine the double black diamond of veterinary medicine. And it can be very difficult. But if fear is stopping you from doing it, do what I did, because if I can do it, you can do it. And yeah, in ER, I found the love of what I really want to do. I went into veterinary medicine after I lost my first of many, many rescue dogs at age 1.5 to a very strange disease process, closest I can come to right now with the medical brain is lymphoma. But I spent 5 days at a specialty center in Colorado, and I watched all of the techs and all of the veterinarians work their way through busy days as I was sitting in the kennel with my dog. And I mean, I spent hours upon hours there, obviously, with him, but he would fall asleep. I would watch the techs do their thing, and I'm like, man, I want to do that. And so I started my journey and said, I'm going to sign up for school. And, That's how all that happened. You know, losing a dog at age 1.5, one that you've fallen in love with, is terrible. But there's always a silver lining in everything we go through. And to me, it led to a 20+ year career in veterinary medicine where I've been able to do a lot of good. So, good things happen.
Yeah, for sure. I actually worked in oncology the majority of my clinical years. And so, whether that disease process wound up actually being lymphoma or not, I hear you. I
Yeah.
get that. It's awful. And, I actually originally had planned to go be a veterinarian and working in the clinic and watching what the technicians were doing. I was like, I don't want to do that. I want to do that.
Yeah.
So, similar, right? Like
Yeah.
you watch the action, you're like, they get to just sit in the office all day, come out and like touch things and then go back in the office. I wanna be with the
Yeah.
patients, right?
I
So,
agree.
kinda
I
similar.
agree.
Yeah, yeah. What made you start obviously, you have this history of why you wanted to get into vet med, but what made you start sharing online?
Yeah, that's a weird one, right? Because I've been doing that for a few years now, and I had always done. I have a little bit of a background in graphic design, social media management. I started doing social media for one of the larger three-lettered corporations, and I became very successful in that. I had one of the biggest accounts for that company. And I actually started like when MySpace and Facebook was a thing, right? Facebook's still a thing, but when MySpace was a thing. So it was all really self-taught and it was all trial and error. There wasn't any college courses in marketing, social media, none of that stuff, right? So it was just kind of like, okay, this is what you do. The main reason that I started making videos is because I wanted to bring some joy and some happiness back to veterinary medicine. I think most of us can agree that veterinary medicine can be incredibly taxing, incredibly tolling, and there's a level of toxicity to our field. I don't think there should be, right? I don't think it should be at the level that it's at right now. And so I wanted to bring joy back and I wanted to show people that not only can this be a fun job, because it should be, but to remind me people to have fun while they're doing it. More importantly, that this can be a longevity type of thing, right? Like an old timer like myself. Yes, I've been through the ringers and we'll get into that in a little bit, but I made this a career. And I get paid to the point where I can actually support myself. And it's one of those things where I'm like, man, I want to share this with everybody else. And then the other side of things is, yeah, my mental health struggles and my addiction struggles is something I wanted to put out there because, as we said before, silence is absolutely deadly. And I'm in a position now where I get to talk about that. And as a 6 foot Viking covered in tattoos, I'm not supposed to talk about my feelings. I'm not supposed to have mental health issues. And I say, bullshit. I will talk about it. I've been through it. Most of it's self induced, some of it, coming from the outside in, but I'm here to talk about it. And I'm here to put a voice to that stigma that we've created around mental health, especially for males, which is like why we should be no different. Mental health doesn't care if you're a man or a woman. Mental health doesn't care if you're gay or straight, black or white, religious or not. It doesn't care. It comes for us eventually if we let it. And I had to battle it for a very long time. And most of those battles I lost. I tried many different techniques until I figured out a way to get through it. And I want to share that with people. And I want to know that people are not alone. And I've done a few podcasts where I talked about this. I will say this. If you're struggling, I at the very least am here for you. You can reach out to me. My DMs, I check them every single day, multiple times. Even the requested folder where it's like we may not be friends on any of the social media platforms, but I'm here to talk and I'm here to share the blueprint that I created to work my way out of the darkness. And I will gladly, I should put it in a PDF in all honesty if I could, but I will gladly talk to anybody and help people find their way out of the darkness you might find yourself in today, because there is a way out, as daunting as it may seem.
So I was asked the other day, and it wasn't necessarily about mental health, but it's kind of in the same through line, why I'm so brave. So just to give you a little bit of context, I was sharing a story with somebody that I coach about having told a CEO of a company that I'm happy to help you, but I'm not going to just be a yes man, right? I'm going to tell you what my real thoughts are. And so I was asked by this person, like, were you born with that? Like, how'd you get there? And so hearing you share that piece of your story immediately kind of brings me back to that question and makes me want to ask you that, like, at what point in your journey did you like gain this bravery to say, you know what, like, I'm going to share this because I think that you don't just wake up one day and get the courage to just speak out.
Well, first and foremost, I was not born and raised in the United States. This American accent, it's fake. I had to adopt it, so to speak, because I lived in New York the first year I was here, and it was in seventh grade. So seventh grade is a struggle for really any kid nowadays. Like it's a really awkward time in your life. Then coming to a different country, not speaking any English, looking different, smelling different, all of it. You know what I mean? I got bullied pretty good for being a foreigner. And, you know, back in the early 90s, late 80s, bullying wasn't necessarily on the radar. We didn't really know what it did, but I definitely it was difficult, right? That being said, being from Holland, you being from the East Coast, you guys can typically relate to this more than most. We have a thing in Holland called Dutch directness. You can Google that. It's an actual thing. The Dutch are known for being rude. In Holland, we consider it direct, right? We're under the assumption that we want to tell each other how it is, when it is, why it is, with as little sugarcoating as possible, because sugarcoating to me is exhausting. Okay. Like if I want feedback, especially being in the ER, I don't always have time to tell you, listen, your compressions overall, you're doing really well, but let's try to work on this. I'm like, no, go faster, go deeper, go harder, right? Like I don't have that luxury. And again, being from a culture where we very much value direct feedback and we're not going to be upset about it, because if you give me feedback and I choose to focus on the method in which you delivered that feedback versus what the feedback actually means, I lose the message and I lose what I could potentially work on versus you hurt my feelings. I'm not going to listen to you. That being said, the bravery, as you call it, I've never looked at it like that. It's just one of those.
I honestly, I didn't either
Yeah,
when the question was asked. It is like it was only a couple days ago, so it has been spiraling in my head, and so it's one of those things that I'm like, I never really thought about it that way. So I'm
I think
sorry, now I'm
if
giving it to you.
yeah, other people
Now I'm giving it to you, but yeah.
other people call it bravery. That's great. For me, it's a necessity. And I think bravery, honestly, in many situations becomes a necessity, whether it's a soldier carrying out his wounded buddy, right? It's a necessity. You don't feel like you're brave in the moment. And I've never looked at myself as brave for this at all, but it is a necessity for me to speak out. I think that if I hold my story in or I hold my struggles in, I'm not going to be able to help the next person who may hear my story. And that's honestly when I went into recovery from addiction. I had a few people who I really looked up to, I really respected, big motorcycle guys that came in and started being vulnerable. And I think the the idea of being masculine and manly, to me, it means many, many different things. To me, masculinity and manliness is more so about being vulnerable, listening and caring for the next person instead of I'm the biggest guy in the room, I could beat everybody up, or I'm the biggest guy in the room, I have the loudest mouth, like that's not manly to me. For me, manly is self-control. For me, manly is being able to help others. And again, that vulnerability aspect, it takes a whole lot more energy and courage for me to be vulnerable than it does for me to just keep my mouth shut and not say anything. But again, once I heard other people that looked like me, sounded like me, and I wanted to be like, share their story with true vulnerable grit, I said, okay, obviously this made an impact on me personally, individually. Let me do that too. And I'm now in a very unique position where through the program that I am currently in, I get to help other guys like me out, and they in return get to help others out because I can only keep what I have by giving it away. And again, that is that overall blueprint of how do you get through mental health issues, how do you get through addiction issues, and what can you do to get better. And so that's where it came from.
Yeah. When you think back to your time working in shelter medicine and even now working in the ER, but all of the times leading up to where you are now, right? What are the pressures or the moments that quietly added up to things before they felt unmanageable?
I love how you worded that, right? Because I've spoken about this before. It does happen quietly and it happens slowly. So there wasn't one day where I went to work on a Monday and then I left at the end of the shift and showed back up on a Tuesday, and all of a sudden it was darkness around me. The darkness creeps in.
Yeah.
So you have a really hard time identifying what is happening. It started with physical ailments, right? My lower back started going out. I started getting this tension in my neck and in my shoulders. And what I didn't know is like the mental health portion, the emotional toll that it was taking was creeping in even slower, even stealthier, right? I realized that there was a point where I started self-medicating after work, and then I started self-medicating before work, and then I started self-medicating during work, and before I knew it, I was jumping from job to job to job. I would quit before I could get fired. I would blame everything around me except for looking at myself, right? Because that was the easiest way out. So the moment that I really realized I needed to do something about it is when I saw that the common denominator was me. It wasn't necessarily the hospital that I worked at the time. It wasn't the toxic culture of veterinary medicine, as we like to label it so often. It wasn't the negative feedback I was receiving from other people. It was me, me, me. And so the only thing that I have control over in this lifetime is my reaction. I don't have control over my feelings. I don't have control over people, places, things. None of those things I have control over, but how I react to that is something I do have control over. And so for me, the journey into the darkness, as I will say, was very slow and very deceiving. And you don't know what's happening, but at the same time, right, you know something's wrong. And like then you have the choice: are we going to do something about it? Are we going to find a way through this? Or am I going to sit in it,
Mhm.
keep covering it with a band-aid, i.e. drugs or sleep or food or whatever it may be? And that's the choice I made for a very long time before I said, holy shit, I have to do something here. I have to do something different. Nothing changes if nothing changes. So it's
Yeah.
something you have to jump on, but it can be difficult and daunting when you're in the middle of it. You can't see the trees through the forest, right? And so
Yeah.
the struggle gets real and it gets, but it's a slow onset. It is a chronic slow onset. Yeah.
Yeah. And you say it's a slow onset and that there's not like one moment. But at the same time, you say that you had to like realize that it was you. So where is that moment that you realize I'm not okay, even if you don't have words for it? Like where is the moment where it's like I don't have anyone else to blame but myself. I have to do something because nobody's going to do something for me. Where does that happen?
It was honestly one individual that came up to me. I walked into a place where there's a lot of support in the addiction community, and this old man came up to me who honestly I consider family at this point. He's helped me through so much. But he looked at me and it was my first week there, maybe even my first day, I don't know. And he said to me, "Are you in pain?" And I was. I was struggling. I was 170 pound. I was detoxing. I was feeling miserable. I said, "Yeah, I'm in pain. Why would you ask me that?" And he looked at me and he goes, "Good." And I was ready to let my hands do the talking from that point on. But he followed it up with, "Maybe now you'll do something about it." And so the moment, as you phrase it, right, there was multiple moments. But once I was beaten enough, I became willing. The person that was holding the stick beating me was me. I think it was a bunch of different circumstances that happened, right? Knowing that I was self-medicating at times that I shouldn't have been, that was the first red flag. Knowing that I couldn't hold down a job, that was another red flag. Knowing that I hated going to work every single day, that's a red flag. But it was
Yeah.
never veterinary medicine that caused it. And I do want to make that very clear, right? Being in veterinary medicine is difficult and it's hard. And I'm not going to take that away from anybody. And I don't care if you're in GP, I don't care if you're in shelter medicine, ER specialty. Veterinary medicine is difficult, but it didn't cause my problems. My problems were already there. Veterinary medicine absolutely helped those problems along quite a bit, but it's because I let that happen and I didn't jump in when I was supposed to. But if any of these things are ringing true to you, that's the point where you should start doing some self-reflecting and be like, what can I do for me? Because I'm not blaming anybody like this. You're the problem. You're like, I absolutely was part of my problems. But what I mean by that is that I wasn't choosing to do something about it. And there's many avenues to go down, right? I tried psychiatry and therapy, and I believe there's a place for that in this world. Absolutely. I think everybody should talk to somebody. I personally, it didn't work for me. Something else worked for me, and it's not something I'm going to promote. Unfortunately, it is against the rules of the program that I work. If you guys are interested in knowing what I do, you can direct message me and I will talk to you guys about it. However, it's there's a lot of different avenues. The one I found worked for me and it might not work for the next person, you know? I think we are in a society now where people are so quick to say, "You feel a certain way? Here's a pill. It'll make you better." That's a slippery slope. That being said, I was very resistant to taking medications for mental health. And this is an example I love using, an analogy, a metaphor, if you will. If somebody is a diabetic, their pancreas isn't doing their job, right? Like what do? You take insulin and you feel better. If a diabetic comes up to you and goes, "Well, I'm not going to take that medication because I don't believe in being on medications for the rest of my life. Like it's a weakness. It's not something that I need." You're going to look at that person and go, "You're crazy. You're going to die. You're going to lose a foot. You're going to be dead within a couple of
Right.
years." The brain is an organ just like your pancreas is. Yet
Yeah.
when my brain isn't doing what it's supposed to do and I refuse to take medications, it's not as hard hitting as a pancreas and insulin and diabetes, right? However, the effects are the same. Untreated mental health issues lead to death, be it through
Yeah.
suicide, be it through addiction, alcoholism, all these things, right? So for me, once I flipped that switch around and I'm like, hey, there was a medication that worked very well for me. There was also another medication that a psychiatrist put me on that drove me straight into rehab because, I was struggling with anxiety and panic attacks. They put me on a very specific medication for that to calm me down. Oh, it calmed me down all right. I was sleeping 18 to 20 hours a day and I was
Yeah.
heavily addicted to those very quickly. So a pill is not the answer. A pill can be part of the answer, right? But again, it's just one of those avenues, whether it's medication, whether it's psychiatry, therapy, talking to somebody, whether it's a support group of some sort. I right nowadays I love reading books on like self-help stuff and I've read a couple of them. A lot of my favorite ones are actually leadership books, right? Like Extreme Ownership was a big one for me that I was like, "Oh my god,
I
like
have.
it's
I was like, is it there? I know I have it. I just don't know where
it's a
it
great book. It's a
is.
great read. It's a little heavy on the military side, which to me is very
Yeah.
appealing and I love it. But that was a really cool one, not only to teach me how to be a better leader on the floor in the emergency department, right? But also
Yeah.
how to take extreme ownership over myself. I think Dare to Lead by Brene Brown is another really good one where she talks a little bit about her addiction journey as well. Anything by Jocko Willing, honestly, is for me a great one. James Wooden has some really great books. But these books teach you how to be a better leader. But to be a better leader, it typically always starts with you. And so for me, I was like, oh, Atomic Habits. That was another really great one for me where I was like, oh my God, like we always expect to advance whatever we're working on quickly, right? Because we're instant gratification. But it was like, no, just make everything 1% better once a week. And at the end of the year, you're going to see this giant leap that you've made from January to December. So those are all avenues you can go down and talk to somebody. Talk to somebody. And again, I am that somebody. If you're struggling, I'm here for it.
Yeah. I think one of the things that resonates with me, aside from the books, because clearly and I'm surrounded by them. You can't see all of them, but it is that all of those things that you just mentioned, whether it be medication or talking to somebody or support groups, in and of themselves, they are not always the golden ticket, but together. Just like medicine, right? Multimodal approach, right?
Yes.
Just like when we are treating diabetes, it's not typically just one thing. It's
Yeah.
not just insulin. It's also what are we feeding? What is our lifestyle? It's
Hmm.
it's a lot of different pieces all put together. And so, what are we for mental health? Maybe we have a medicine. Maybe we also have somebody we talk to. Maybe we also have a support group. Who are we surrounding ourselves with? Right? Like it's
Yeah.
it's a lot of
Yeah.
different things. What are we eating? Right? Like it's a lot of different pieces that I think that we don't always realize that it is a full system. And so, like, our bodies are a system, our minds are a system, every piece of us are a system. And so, when we look at it as a systematic approach, often like versus one piece at a
Yeah.
time, we're better off in the long run. And so that's what resonates with me
Oh,
when I
you
hear what you're
you
saying.
nailed that because again, back to Atomic Habits, right? It's 1%.
Yeah,
Some solutions may be 10%, but it is a lifestyle change in a way. And that
yeah.
sounds so daunting. That sounds like a huge mountain. Like I
Oh yeah, because
can't
it's huge.
yeah, I can't climb that. You want me to change my entire diet? You want me to change my entire way of doing? I can tell you right now that the energy that goes into being miserable, take about 20% of that and put it into a gradual lifestyle change. And again, I'm not preaching anything I haven't had to do myself.
Yeah,
And
yeah.
it's doable.
Same.
It's doable, but I love what you said. It is a systematic approach from many different angles. And no, there's not going to be one solution that's going to fix you. Boom, you're done. Oh, thank God. The longest road is typically the most rewarding one. And I've had to walk that road, but for lack of better words, I will walk that road with anybody that wants to start off and embark on that journey. I'm here for that
Yeah.
because I've had to do it myself. And I mean, my life started when I really was in a dark place in bed, and I didn't leave. I would order food. I'm doing drugs. Like, I'm not leaving my house. And that's because it requires energy to do that. And it's such a double-sided sword, right? Your mental health, your issues are draining your energy. And at the same time, you are also stuck in this like, I know it's hard. Like, it's not an easy thing. It's a very simple method that I can give you. It's not easy. You still have to walk. But,
Yeah.
even though not one thing may be a cure all, certain things are going to boost you and help you and recharge your batteries to the point where now you can get to the next marker. Now you can get to the next solution, to the next thing that's going to help you. Because just reading a book isn't going to do it, right? Just taking a pill every day isn't going to do it. Just going to talk to somebody, you combine those things, you start doing a little bit of exercise, which, trust me, I hate. You start feeling better. Like, you really do. And I hate that a McDonald's Big Mac doesn't do that for me, or binge watching a Netflix show doesn't do that for me. I don't know why all of the really good things for you in life have to be so damn difficult. That being said, those things can still be part of your life. They just can't be all consuming, right? Everything needs to happen in moderation. But for me, like, yeah, I love what you said. It is absolutely a multimodal, and we all work in medicine. We know how medicine works.
Yeah.
Serenia isn't going to
Hopefully.
fix the problem by itself, but the underlying issue being treated is going to, you know, it's
Yeah.
fantastic. You nailed it.
Yeah. One foot in front of the
Yeah.
other. And sometimes there's a back pedal, but one foot in front of the
And
other is
sometimes
the
there's
way.
a sprint where all of a sudden your feet are
Yeah.
really going without you even knowing it. But yeah, sometimes you take a couple steps back. Life throws you curveballs. Learn how to hit
Right.
those curveballs. It's doable. Like,
Yeah.
I will smash a home run with a curveball nowadays. Like, the fun part is I adopted this train of thought when it comes to curveballs, right? Is nothing grows in your comfort zone. And I didn't just listen to that and write it.
That's
It is, but I didn't just like write it on my mirror, listen to it and say, oh my God. No, nowadays when I'm uncomfortable, be it with a new procedure in the clinic, which I'm too old for that. I haven't seen a new procedure in a long time, but doing something that makes me feel icky, I nowadays immediately couple it with I'm learning something, and I'm
Mhm.
going to be advancing into something where I wasn't before. I am teetering on entering the VTS program, right? And if you want to talk about uncomfortable, oh my God, I'm terrified, terrified. But again, it's one of those things where I'm like, okay, are you going to let fear dictate your decisions? Are you going to let fear stop you from placing that IV catheter or that central line or going for your VTS? If so, I have really, really shitty news for you. Like, you're going to be stuck. You're going to be in a
Yeah.
very comfortable place for a very long time where nothing grows, and it's going to be miserable. You're going to become complacent. Mistakes are going to start happening, and misery follows shortly after. So,
Yeah. And let's look at ourselves when we're 80 something, 90 something, if we make it that far. Were you really that comfortable?
yeah,
Like, are you going to be
yeah,
happy with the decisions that you made? I
probably
say it
not.
all the time, shoot your shot.
Yep,
Shoot your shot. And what's the worst thing that could happen? Somebody's going to say no. Okay. They
yep.
say no,
Or you're going to
right?
fail. And then
Uh,
what? So what? You know how many
it's a
times?
learning
Yeah,
moment.
you know how many times I've failed things in my life? Good Lord. If I go for the VTS and I fail, great. I'm going to share it with everybody because if it stops somebody else from not doing those things to make themselves better, always be learning. Always keep going,
Yeah.
keep moving. We're like sharks. We can't stop swimming. And once we do, we're at the bottom of the ocean doing absolutely nothing. And I don't want to be there anymore because it's a dangerous place for me to be. Then I get stuck in my head and I wouldn't share this thing up here with anybody. It's not a fun place to be.
I'll stop. That's all you're doing is sharing
Yeah.
what's up there. Now, I heard you say that it was your responsibility to basically pull yourself out of this,
Yeah.
right? And that nobody could do it for
Yeah.
you. And so I subscribe a little bit differently to that. And so I'd like your take on this. And so I talk a lot, and I've already mentioned this about systems. And vet med is a system. And we live in this system of a profession and being a leader. I feel like a lot of times leaders have a responsibility to take care of our people. And a lot of times I see companies and leaders just offloading things to an EAP, a social worker, a resource. Here's another, you're having issues. Here's another resource. Instead of providing psychological safety, providing that space where you can have a place to
Yeah.
sit with me and being that source of place, right? Maybe I can't fix it for you, but I can be a place for you to go that's safe. I can provide those resources. I don't have the answer to what the fix of the system is because we've been so ingrained into this system, but I'm looking for what those are, and from somebody who's been through the system, who's figured out ways to get out of this themselves. Are there things that you believe that leaders can do to help where leaders currently fall short, where they fell short for you when you were struggling? And if there's a hospital manager or hospital leader that's listening right now, is there something that they can do that you wish that they would do to stop minimizing and explaining away what's happening?
I want to quickly pause here because if you're a veterinary leader listening to this and you've ever thought there has to be a better way to do this, you're not alone. Inside the leading veterinary teams community, we're having the conversations most veterinary leaders are thinking about but are scared to have out loud. We're talking about leadership, culture, and the systems that we're all working inside of. But most importantly, we're working through ways to poke holes in the old systems. If you're done pretending that the systems we inherited are working and want to start having real conversations about what leadership actually looks like, pull up a chair. There's plenty of room in the community. Just head to lvt.vet or check out the show notes for the link to join the community. All right, let's get back to the show.
Absolutely. And I will say, I completely agree with you. Everything you just said. I have nothing to add to that. You're right. When I say like it was on me, I was an unteachable and an untrainable person. I didn't want to take any feedback from anybody. I sure as hell wasn't going to help the next person. And I was very ready to throw somebody else under the bus. That was all on my
So
side.
what do I do as a hospital manager with you when
Exactly.
you're
And that's a really difficult question because we're always going to have those employees and we're always going to have those coworkers, right? And as a leader myself on the floor, the biggest thing that I can say is we have to create a safe culture. Now, how do you go about doing that? First and foremost, I think setting a standard to being like, listen, we're going to give each other feedback. Let's not take it personal. Then teaching people how to give said feedback to make it not personal is also super important. Unfortunately, there's no
yeah,
cure all. Again, it's a system because each personality that we work with, and we all work with several personalities in our clinic,
yeah,
has to be approached differently. As leaders, again, when I got the opportunity to lead, my leadership team currently really focused on us reading all of these leadership books. Servant leadership was a really good one for me that I read, right? Is that I kind of lead by example. There's a caveat to that.
yeah.
Sometimes when I lead by example, I say, forget it. I'm just going to do it myself instead of delegating and teaching the next person how to do that. Right. But I had to be a teachable person and I wasn't teachable for a very long time. So that again required that self reflection like, oh my God, I am that jerk off that's not listening, that knows everything best. Oh, guess
Yeah.
what? I've been in specialty medicine and I worked under a criticalist. This criticalist taught me that this was the way to do it. There's 1,000 different ways to
Yeah.
Rome. Okay. Let's not all end up in Italy the same way, or we may not all end up in Italy at the same time, but we're all going to get there eventually. Um, there's three things that I really, really harp on. And the company that I currently work for is very big on this because culture is going to be the start. I think if you look at these larger companies that started blowing up, Google does things very differently. Apple does things very differently, right? They've created this safe space where people get to come in their jeans, in their whatever. And it's a corporation where normally you have to wear a suit, tie, and women have to wear high heels and God knows what. And I'm like, no, it shouldn't be like that. We should be comfortable physically, emotionally, mentally, spiritually at our job. So as leaders, we have to create that culture. Now, how do we go about doing that? First and foremost, we have got to stop talking shit about each other. In veterinary medicine,
Right.
especially, like being
Right.
in the ER, one of the biggest things that we often see is we have to fix things that were caused at a GP. Already, that entire sentence is bullshit. The GP, the
100%.
general practice, did their best. Their technicians, their doctor did what they thought was right. Mistakes happen. Let's not be like, oh my God, why did they poke this arm 6 times? Now I have to place an IV catheter. You don't know what was
Were
going
you
on.
there?
Yeah, exactly. You weren't there. We're all on the same team. So
Right.
for me, that talking shit about other hospitals and each other in veterinary medicine, you weren't there.
Yeah.
You don't know. And yes, sometimes mistakes happen. I'm going to challenge everybody that's listening right now. You never made a mistake. You've never done something detrimental. Now imagine you made that mistake. We are the best at beating ourselves up, right? I'm going to go home. I'm going to carry this with me for weeks, months, years. Somebody else is jumping in on top of that and starting to beat you down a little bit more. That's not cool. That's not fair. Nor do they need to, because I'm already doing a fabulous job of that myself. Trust me, there's no beating you can deliver me that I don't do 1,000 times better. But like, we
Yeah.
have to stop judging each other and saying, why did this technician do it that way? Why did this doctor make this diagnosis? Because with the information that they were given and the experience that they have, they did the best that they could. We all treat animals. We're all here for the same reason. We're good human beings that want to help animals. And people, because let's be real, when my dog gets hurt, I forget what I do for a living and I need a professional to come tell
Oh my
me,
God.
it's like, I've
Absolutely.
seen my own
Yeah.
dog's blood a couple times. Like, I don't know what to do with this, you know?
Yeah.
So,
I mean, my dog ate a toy yesterday, and he had diarrhea. And my husband's like, "Are you going to help me?" I was like, "Why? Because I work in vet med." I, I'm sorry. What? I didn't know that was my responsibility.
oh,
What?
that's so true.
Just because that's what I do for a living doesn't mean that that is what happens here.
No, all rules go out the door when it happens to your dog. Like, that's my
I
baby.
know,
Yeah,
right? What?
that's not a
But
thing.
to your point, what you just said was it's based on what's happening in front of them, but also their experience, right? And so what I'm immediately reminded of is that I started in vet med in a specialty emergency clinic, and then I worked, and I heard those things, I said those
Yes,
things, I
same,
said
same.
animals came into the ER, and I was placing catheters, and I was like, what the is this?
Yeah,
Like, why would they do this? Why is this arm all ripped up? Like, why does this look like this? And then I went and I managed a general practice, and I saw what was happening, and I was like, "Oh my god, we have to send this to the ER. Oh god, like, I'm so sorry." And I would call them and be like, "I'm so sorry for the way that this animal looks. Like, we try our best, right?" Like, and knowing my background, right? And I'm like, "I'm so sorry. Like, this is what it is. What it like it is what it is. But this is what you're getting. My bad. We did the best we could, you
I
know."
love that.
And changes your perspective
Uh-huh.
because you have now a new experience. The problem is that when people are saying those things, it's because that's their perspective. They've never experienced any other
Yeah,
thing. And so my challenge to what you're saying, what I've experienced, is just think about things from a different perspective. Like
yeah,
before you start judging people, get a little bit curious. Think what might have gone on that why did we have to do all of this? Maybe they're so short staffed they only have one person. They
uh,
don't have somebody they could tag in to poke multiple times. Like we have a 2 poke rule. Okay, yeah, I'm sure that's perfectly fine in clinics where you have 45 people to poke if you
yeah,
have to. But when you have one person, or you're in New York State and you're actually following the rules, and and you don't have a licensed technician on the staff, and the only person who could poke is the doctor,
yeah,
and there's only one doctor. You got to do what you got to do, right?
yeah.
Like you're doing the best you can with what you have. And I think that we just need to be a little bit less judgmental, a lot less judgmental, and a little bit more
Yeah,
curious.
but you're 100% right about that. And I think that what's the solution to this? This conversation right here. And more people need to have it, and it needs to be exposed more, because like, I don't expect everybody to have worked every facet of veterinary medicine, right? And I don't expect everybody to know. What I did really love that you said is you would call them ahead and say, I'm sorry for what I'm about to send to you.
Try.
What does that come down to? Communication. That's it.
Hmm.
As a technician, when a patient transfers, right, we typically go doctor to doctor transfers. Be the technician that calls them up as well and say, can I talk to your shift lead? Can I talk to your charge nurse? Can I talk to somebody there? And be like, listen, guys, this is what happened. And you may not always have time to do that. So if we are all under the same assumption of like, they tried the best that they could, now let me fix this or let me add on to this, right? We're already in a better place. But that level of communication that you mentioned is huge, because listen, I can remember the 2 or 3 times in the last 5 years where a general practice transferred something to us and I spoke to somebody about it and they said, man, we tried and it just didn't work. And I'm sorry if we gave you somewhat of a shit show. Like, listen, if you're an ER specialty, it's what you signed up for. All right. Like, I hate to put it that way. We're going to get shit show cases. Are you going to yell at the car that ran over the dog because it ran over every limb and God knows what, and now it doesn't have any veins? No, you find a way. You find a way to make it work. And we don't know what happened at that general practice. And I'm just totally throwing general practice out here constantly, but it can be specialty to specialty. It can be ER to
Yeah.
ER as well, right? It's the
Yeah.
example I use because, as like you said, I've been on that side. I've been a general practice technician and I had to send something and I'm like, shit, like this is going to be crap. We try to do the best that we can. We try to send blood tubes with the patient, right? Or an IV catheter.
Yeah.
Not everybody uses the same T ports. Somebody might just be using a quick male adapter. And I'm like, now I have to replace this whole thing. Guess what? You're going to probably have to replace it 2, 3 days from now anyway, if the patient stays there long enough. The
Right.
energy we put into hating each other, the energy we put into criticizing each other, if that gets put into practicing proper medicine, are the toxicity, quote unquote, in our field is going to be lifted by not 1%, not 10%, but at least half. And then we can all
Yeah.
say we're on the same team, we're playing the same game in the same arena. We're doing what's best for our patients to the best of our ability. But if we continue to hate on each other and talk shit about each other, and as you said, I've been guilty of it myself. I was not always the poster child of, oh my God, let's be nice to each other. No, we get taught from our predecessors. We get taught
Yeah.
from the people that came before us. That's not an excuse to do it. Change
Yeah.
it. We don't all
Yeah.
have to sink before we learn how to swim. Like, I remember my experience coming into veterinary medicine, there was some really rough techs and some really
Yeah.
harsh doctors back in the 90s. They were typically all 60-year-old men who just didn't want to hear from their nurses. And it's like, manually developing x-rays. Or why did that take 45 minutes? I'm like, hey, doc, you can come in here and do it yourself. But there's a reason for everything, and we don't always know that
Yeah.
reason. Just because somebody cuts you off on the road and you want to honk your horn doesn't mean that they're not on their way with a puppy in the back of their car to an ER to do, or with their child, God forbid, that's sick and they're trying to get, we don't know what's going on through other people's heads. And it's not just a veterinary medicine thing, it's a humanity thing where it's like, man, give
Yeah.
them the benefit of the doubt until they prove until they prove otherwise, which 9.9 out of 10 times isn't going to be the case, man. There's always a legitimate reason why something happened. And I'm going to be the last person to say, holy crap, why would this nurse do this? Why would that doctor diagnose this? Are they stupid? No, they're not
Yeah.
stupid. I'm the stupid idiot for assuming that they're stupid. And that's the only level of stupidity in that entire equation. But it's something that, as you can tell, like I'm getting heated just talking about it because, for one, I
Yeah.
participated. I did. I participated in that behavior. Now, as somebody who is a mentor, a teacher, and somebody who's bringing in the new line of technicians, and yes, we have different work ethics, and oh my God, I can go rounds about that all day long, but it doesn't matter. Work with what you're given.
Yeah.
There's still going to be the next line of vet techs that are going to be working on the same patients you are. If you want positive results and you want changes to happen, then you're going to
Yeah.
have to be part of that change. And I learned that, unfortunately, but I learned that from listening to conversations like the ones you and I are having right now, by seeing
Yeah.
the negativity that I was a part of spreading. And I do regret it, but I learned from it, and now I'm going to be different, and have been for a while
Yeah.
now. And that's how we're going to change veterinary medicine, hopefully.
Yeah, when you know better, you do better, right?
100%. 100%.
Yeah. And I think that the other thing that we're circling around is, as leaders on the floor, when you do hear those things, it's our responsibility to stop them in their
Yeah.
tracks, right? It's our responsibility to say, we don't do that here. Right. Like, listen, we both just admitted that we have said those
Yeah.
things in the past, but we don't anymore.
Yeah.
And therefore we don't do that here. So
And I think
move
that level
along.
of
Right.
vulnerability is huge, is saying, listen, I used to be a
Yeah.
part of this, right? I've done this myself. And I guarantee you that
And it's not okay.
it's not okay. The nothing I did was fine about that, man. I've treated some people like
Yeah.
shit, and I don't know why I did that. And I think it was my own insecurities, and it was something that I saw in them that I once represented. And it's like the harshness, it doesn't need to happen. I do think, when you are dealing with that personality, right? Let's just take me 15 years ago,
Yeah.
and you're dealing with me 15 years ago, to have a difficult conversation, or as my girl Brene Brown would say, are you ready to do a little rumbling, right? And setting the table for said rumble conversation. Like, can I give you some feedback? Because what I saw was not okay. We don't have to be super soft with each other when we're in those scenarios. Like, I do think that those require a little bit more assertiveness because it needs to stop. We all know that a bad apple can spread like cancer in the clinic, and it can create a very negative culture. But we, as veterinary professionals, not just leaders, especially, yes, it does come down from the top. But when I say I had to make changes, the changes I was making was dropping a pebble in a pond, and that ripple effect. My personal changes started affecting the changes that I was making in the clinic. And now I get to spread positivity and culture. And I'm literally in Florida right now, opening up a new hospital for our company. And one of my main focuses is going to be training new technicians that haven't been in ER or are new to my company. And the biggest thing that I focus on as a leader, right, is I could teach anybody to place an IV catheter. I can teach anybody to place an NG tube or a central line or run an anesthesia on an ASA 5. Yes, it takes experience and time, but my biggest focus is those soft skills that are very difficult to teach. And some people are born with them, that wisdom. Some people are not, but it can be attained. And so for me, culture is the biggest thing right now, is that it's a culture of safety, it's a culture of acceptance, and it's a culture of peace. Because the last thing that we need is to have a 5 to 10 euthanasia a day and then jump down each other's throats. Need I remind the listeners out here that we are still in the top 5 of suicide in our field? Do you think it's just burnout, fatigue, compassion, all of those things? Or do you think it's the way we treat each other as well? It's the way we treat each other. It's not just
Yeah.
student loans. It's not just the fact that you just killed a 3-month-old puppy because it got hit by a car and it needed to go to a better place, right? That's not why. It's part of it, but again, that systemic approach,
All the
it's a
things.
lot of different things,
Yeah.
and the way we treat each other is a big chunk of it. So to sum it all up, stop being a dick, all right? To put it in Dutch and New Jersey talk, stop being an asshole. Like, try
Yeah.
to put
Yeah.
yourself in another person's shoes just for 2 seconds. God, you got me all
Yeah.
fired up now
I love it. I
in a
love
good
it.
way.
I do love that you mentioned, I mean, we've like talked way past it, but earlier you mentioned that I'm from the East Coast and we just tend to like I talked about bravery and courage and we tend to just say how we feel. And I never really thought about what I had said to that CEO having been courage. It just like it's a waste of my time to sit here and say yes to you.
Yeah,
Like really at the end of the day, you're asking for my
yeah,
opinion to help you with an organization. How are we going to move forward if I just say yes to you? Like I'm trying to help you do a good thing here,
yeah.
right? Like, and it's the same thing when I'm giving feedback to my team. It's the same thing when I'm even the questions I've asked you, right? Like, I'm not going to waste my time just like, oh, okay, it's the difference between being nice and kind. Like sometimes like it would be nice to not hurt your feelings, but at the end of the day, it's more kind to just tell you what it actually is and get past all of that fluffy crap,
I
right?
agree.
And I think if people understood that I'm not trying to hurt you, it's coming from a good place, it then assume good intent, right? And I think that sometimes that gets overused, but you circled around that too. So I think I just wanted to call it out because it's something that
Yeah,
we
and
both have been talking about, but we didn't say it out loud.
no, no, and I agree, and I think you and I, like I said, the way we were raised in our culture, it's a little more easy to do that. But I will say, like the way you wrap something up, like ultimately, if I get a PlayStation 5 for Christmas, I could care less, and I don't know what the wrapping paper was that it came in, right? I care about the contents of the thing, and that's how these conversations are too. The
Yeah.
compliment sandwich, or as I like to call it, the
Hmm.
shit sandwich, like I can't.
Same.
But if somebody else like
Same.
prefers it that way, right? We need to, as leaders, respect that and we need to approach it in that way. That being said, I do think that setting the table before a conversation is very important and making
Yeah.
sure that you time it correctly, make sure that you understand their love languages, so to speak, that you
Hmm.
understand their preference of feedback.
Ask them.
Yeah, and more
How do you understand that? You ask
yeah,
them.
I think, and this is such a deeper conversation too. With your
I know.
significant other, when they come home with a problem, right? Like so often we assume that our significant other just needs to understand how to react. But when we are forced to ask, "Hey babe, do you want some feedback right now? Or do you want me to just listen so you can vent?" Typically clears out most of the problems because as a man, I always want to solve. I always want to make a solution to everything that's happening. And that's not always what my wife is looking for. Sometimes she just wants me
Yeah.
to listen. But that's again, setting the table before that conversation.
Yeah.
That takes less than 30 seconds. Like it's not a
I know.
it's
It's
not a big
fast.
thing. Yeah. Like, are you ready to receive some feedback? Because some things happened that weren't super kosher. If that's the
Yeah.
case, then, we can revisit this conversation, but no, it's coming because we are
Yeah.
in medicine. All of us, we are in medicine. We don't have the luxury to make sure, I'm going to quote the Office Space, the movie right now. We don't have the luxury to make sure the TPS cover sheets are all ready to go. We have to make sure that we fix things in the spot. I hope that there's a couple listeners that catch that reference. If you do, DM me. You're not my favorite person, but yeah, it's,
I love that you did the accent too. You like went for it,
yeah.
and then it made you laugh. So I ruined it
No,
for you.
no, but it's like I said, it's not always about that. It's not always about the framing, the packaging. It's about the information that you're
Yeah.
getting. And if you can sift through that, fantastic. But it is up to leaders to make sure that the delivery is also on par with what the person is
Yeah.
receiving. So
Yeah. I'm going to shift just a little bit because we were talking about some heavy stuff for a bit and then we went into leadership. But I want to just dig back into the mental health piece for a second and ask, when you started to share more online about your mental health struggles and sharing on podcasts, were you afraid about how people would in our profession might respond and how you would navigate that?
yes, the first podcast I ever did, which was honestly a huge honor. I like, oh my God, I'm going on a podcast. Oh my God, this is a big deal. And I told my parents about it, and I told my parents I'm going to talk about my addiction. I'm going to talk about my journey, and they go, "Are you sure you want to do that? Because honestly, that could be a little bit dangerous, and we don't want." Yes, my parents have a thick Dutch accent, so we're going to really make this story, real. But they steered me clear of saying the things that I wanted to say, and I found that I was doing a disservice. And it comes down back to nothing grows in my comfort zone. Was it uncomfortable?
Yeah.
Yes, the first time. But that uncomfortability led to growth for not only myself, but for other people. So the short answer is, again, I don't dictate anything out of fear unless it's heights, but I don't dictate any of my decisions based on that. And so the first couple times that I spoke up, yes. And I did get some feedback because everybody in my clinic knows that I am a recovering addict. Everybody in my clinic knows that I have full Cubex access, that I have access to all kinds of things that you would think a recovering addict shouldn't be anywhere near. I am in a path on the journey. I am at a point now where I don't have any issues with that. And I don't think we should judge anybody else. We have checks and balance systems in place. But there was one individual that I found out later whose significant other is a recovering addict too, who actually said out loud to other people, should we really be trusting that junkie with Cubex access? And I said, I promise you right now that just because I identify as an addict, because I am the least likely person to steal medications from a dog or a cat who needs it. I am the least likely person because I have put a bullseye on my back as an addict and as somebody who struggled with mental health, right? So now everybody gets to look at me and put me under a microscope. For every identified addict
Yeah.
that's out there, self-identified addict that's out there, there's 10 of us walking around that are the same exact thing, but haven't said it out loud. So for me, wearing
Yeah.
my addiction on my sleeve, my recovery on my sleeve is a choice. And yes, it is very
Yeah.
uncomfortable many, many times. But the support that I get on the other side of the conversations that I'm having far, far outweighs that one person talking about, should we really trust him? Yeah, you should. And now I'm going to be looking at you under a microscope because there's something that made
Yeah.
you say that, that makes me wonder what's going on in your world. But again, if that person ever came to me for help, which ironically I did help that person with their significant other a lot, it was like it was a slap in the face. But listen, sometimes you got to be slapped around a little bit to make some changes. And for me, it was like, okay, I have to be a little bit more careful who I say things around, but ultimately the feedback I get, the way that I am received in circles nowadays is people know they can trust me because I'm brutally honest about everything, including my own vulnerability. But yes, it's hard. It can be hard, but everything's hard at first. I remember my first IV catheter. This is shaking my way through it, and then you do it,
Yeah.
and it becomes easier, and it becomes,
Practice.
yeah, practice. It's like lifting weights.
Same way as lifting weights. How do we learn how to walk?
Yeah,
Right? How do we learn how to ride a bike? Some people still don't know how. But
yeah,
for the people who do know how to ride a
yeah,
bike, my kids are looking at me like, we don't know how to ride bikes, mom. But for people who do, for the people who know how to swim, like, how do you learn
yeah.
things? By practicing. You don't wake up one day and know how to do it,
No,
right? It's just like communicating and talking. How do you do social media? By posting the video,
yeah.
right? It's just doing it. You don't know how to do something until you just
Yeah, you
try.
continue doing it, and so that was definitely the situation for me here is that Yeah, it was hard. It was hard, but I'm doing it and I love doing it. And anybody who has a problem with anything I say, again, DM me because there's something more that we should unpack. And there would have been a point where I had a problem with a person like myself as well. Like, oh my God, should we trust them? I get that. But if you want my full unfiltered story, I will give you my phone number and we will have a conversation on the phone. Not a bad one, not an aggressive one, not a critical one, but I'm going to let you know what I went through and where I am today because
Yeah.
I went into recovery on February 18th of 2017. So this is very far removed from me, but if I don't continue to keep the humility and keep talking about this and I become complacent in said recovery, it is a matter of time before I make a mistake, I slip up and I find myself back in that deep dark place, and that is something I refuse to do.
Well, if I can do math correctly, then this podcast is airing just after our ninth year. So congratulations.
Thank you, thank you.
So I think that there's so much that we can unpack in what you just said, but I do think we'll have to do a part two
I'm here
because
for
we
it.
will be here forever.
Yeah, 100%.
I do want to just ask if you could speak directly to a technician who's in that dark, exhausted place right now, what would you want them to hear?
You're not alone. You're not alone. And more importantly, there's a way out. And I will help you. I will help you personally. If I'm not the person you want to talk to, there's other people who can help you as well. And I will point you in that direction. I might not have all the answers, but I do know a person who will have answers for you. I do know a resource that will change your life. And I am 100% here for that. You are not alone. Speak up and and let's find a way out, whether it's 1% improvement or 75% improvement. I will help you walk that path until you can learn how to walk on your own. One of my favorite saying is I will love you until you learn how to love yourself. And I truly mean that because everybody who's going through it, somehow we are one huge dysfunctional family, and you are a very dysfunctional relative of mine as I am a dysfunctional relative of yours, but together we can rub some brain cells together and find a solution. So just know that whatever it is you're going through, even if you think that you just heard my story and you're like, yeah, well, mine's different, I call that terminal uniqueness. You are not unique. Our pain is the same. Our struggles are the same. We may have gotten there on a different road. We may have gotten there in a different manner. You may have gone through trauma that I didn't go through, but ultimately that stress, that pain, that anxiety, that depression, it is all the same at its core. And the way out is going to be very similar as it was for me, as it will be for you, as it will be for the person you're going to be able to help from that point on, and so forth. We're going to be able to make a huge difference in us as humans, in us as veterinary professionals. And again, reach out, please. There is no shame. There is no guilt. There's nothing for me because I've done it. I've done it worse than you. And I'm here on the other side telling you there's a way out.
Is there, I always ask for a rapid fire book, but you've already given us some books. Is there any other books that you have top of mind that you didn't share?
Those are
You're
some of
like,
my
everybody has to read this.
there's honestly Atomic Habits is the first one for me. And then yes,
Yeah.
Dare to Lead by Brene Brown, I think was fantastic. Just
Yeah.
because these books sound like a specific thing, right? Like Atomic Habits, oh, what is that going to make me have better habits? I'm gonna make my bed at the Make Your Bed is a really fun one too. And it's short and it has big letters and it's easy to read. Make Your Bed is a great book. But the don't judge a book by its cover is so applicable here because when you lead or when you read Dare to Lead or you read Atomic Habits, it's not always about forming habits. It's not always about being a better leader. It's about being a better person. And there's so many helpful tips in those books that you wouldn't have thought were in that cover, in that little bit of,
Yeah.
So for me, those books are so much more than what their title and what their cover says. Those are two books that I honestly think everybody should read once a year just to brush up on it, highlight stuff, make notes about it. Brene Brown has like a whole resource library outside of her books that I
Yeah.
think is fantastic. There's two other ones. Oh my God. And they have the funniest titles. And I hope you can help me with that. Everything is Fucked, I think is one of them. And that guy who wrote that, it's a book about anxiety. And the guy who wrote that also wrote something like, oh my God, I'm totally drawing a blank right now. It's one of those books. And if you know, you know. But if you type in book, Everything is Fucked, you're going to see that author and all of his titles are just like that. And they're great. They're wonderful. Those are
I
books.
will look it up and I will put it in the
Yes,
show
yeah,
notes.
please do. They're really fun reads. They're really fun reads.
Where can people find you?
in Denver. So
Just go walk around.
yeah, all around
Obviously,
Denver.
we know where you work because it's on your shirt, but where can we find you in
Yeah, yeah.
Denver?
So I have a YouTube channel that I just started. I'm on Instagram and I'm on TikTok. My name is Ain't Doing Right. For veterinary professionals, you know exactly what that means. For those of you who are not in veterinary medicine, ADR is an abbreviation, an actual medical abbreviation we use that does mean ain't doing right for when an animal comes in and we don't quite have a clear diagnosis for them. We call them ADR, which is ain't doing right, which if you've listened this last hour, it's very fitting for me. My Instagram is absolutely the most active, but I started becoming more active on other platforms as well. And, you know, I'm trying to get more fun out there, more resources, more stories about me, more stories about the next person that can help the next person that can help the next person. So yeah, ain't doing right on Instagram, ain't doing right on YouTube, ain't doing right on TikTok. I'm not on Facebook. Some of my fellow content creators have kind of steered me clear from Facebook. So I haven't done Facebook yet. I might add that in the future, but as of right now, you're gonna my biggest thing is Instagram, but YouTube and TikTok are following closely behind that. So reach out to me, please. And again, I'm not one of those people you cannot reach out to or that you're gonna wait a week to get a response from. I will respond to you immediately and check my messages often. So I'm here for people and I'm here to make people laugh and have a good time.
I can account for that because you responded to me very quickly.
Absolutely.
I thank you truly for trusting us with your story, with the laughs, talking about leadership. We went in lots of different directions, but I am very much sure this is not the last time we are going to talk. I know it's not an easy topic to talk about, and I hope listeners hear that it's not just pain in the story, but honesty and humanity and humility too.
Yeah.
And conversations like this are how we change the culture, how we change the system that we work within. And it's not just with platitudes, but with truth. And I greatly appreciate your time and I greatly appreciate you. And I can't wait to see you on more platforms. And whether you think you're not doing right or not, I think you're doing a lot of really good things. So thank you so very much.
Thank you for giving me the opportunity to do this. I honestly look forward to our next conversation. You know, I will come running. Thank you for what you do, talking about difficult things and having difficult conversations. It's important. And what you're doing is, if we can change the life of one person, we did our job today, and anything else is a bonus. So thank you for what you do. Honestly, this is a big deal.
Yeah, absolutely. Well, till next time.
Till next
Thank you so
time.
much. Bye.